Now we are going to discuss multiple cranial nerve palsies. Multiple cranial nerve palsies are the involvement of the various cranial nerves. The cranial nerves can be involved on same side. The same cranial nerve can be involved both sides of the brainstem, or different cranial nerves can be involved on the same side or both sides of the brainstem. These are the multiple cranial nerve palsies. The etiology of multiple cranial nerve palsies are the infectious causes are infectious meningitis, acute infectious meningitis, chronic infectious meningitis, and various infections like Epstein-Barr virus, cytomegalovirus, HIV, HTLV1, and other infections like mainly syphilis, Lyme's disease. The other etiologies of multiple cranial nerve palsies include connective tissue disorders, particularly the sarcoidosis, which causes bilateral facial nerve palsy, and other connective tissue disorders are Sjogren's syndrome, SLE, that is systemic lupus erythematosus. Vasculitic conditions which cause multiple cranial nerve palsies are Wegener's granulomatosis, Church-Strauss syndrome, polyarteritis nodosa, giant cell arteritis. The other causes are the cavernous sinus thrombosis. In that there is a syndrome called Tolosa-Hunt syndrome, in which there is a granulomatous inflammation of the cavernous sinus resulting in multiple cranial nerve palsy. Other causes like amyloidosis, skull-based tumors or clivus tumors, and carcinomatous meningitis. Neoplasms involving the meninges can also produce the multiple cranial nerve palsies, like carcinomatous meningitis, lymphomatous meningitis, neurolymphomatosis. So these are all the various conditions causing multiple cranial nerve palsies. Now we shall discuss the various syndromes resulting in the cranial nerve palsies. The first one is superior orbital fissure syndrome. The structures, the nerves passing through the superior orbital fissure includes the third cranial nerve, fourth cranial nerve, sixth cranial nerve, and the ophthalmic division of the fifth cranial nerve. So 3, 4, 6 and ophthalmic division of the fifth cranial nerve pass through the superior orbital fissure. So any tumor or aneurysm involving this superior orbital fissure results in superior orbital fissure syndrome. The next syndrome is orbital apex syndrome. In this syndrome, the above mentioned nerves are involved along with these nerves, that is 3, 4, 6 and ophthalmic division of the fifth cranial nerve. The other nerve, the additional nerve involved is in this series the second cranial nerve. So this is orbital apex syndrome. Here also the causes includes trauma or aneurysm or tumors or any neoplasms. The third syndrome is Grade-Nigo syndrome. In Grade-Nigo syndrome, the cranial nerves involved are the fifth cranial nerve and the sixth cranial nerve. The Grade-Nigo syndrome is seen in petrositis. In petrositis, we see involvement of the fifth and sixth cranial nerves, where it is called the Grade-Nigo syndrome. In cavernous sinus thrombosis, the cranial nerves involved are the third cranial nerve, fourth cranial nerve, sixth cranial nerve, and the ophthalmic and the maxillary divisions of the fifth cranial nerve, that is trigeminal nerve. So in retrosphenoid syndromes, the structures, the cranial nerves involved are the 2, 3, 4, 5 and 6th cranial nerves. So 2, 3, 4, 5, 6 cranial nerves are involved in the retrosphenoid syndromes. So these are all the various important syndromes causing the multiple cranial nerve palsies. So now we discuss some of the most common cranial nerves. Most common cranial nerves involved in the multiple cranial nerve palsies. The most common cranial nerves are the 6th cranial nerve, 7th cranial nerve, 6, 7, 8th cranial nerve and 5th cranial nerve. These are all the most important, most commonly nerves involved in the multiple cranial nerve palsies. 6, 7, 5th cranial nerve and 8th cranial nerve. The various combinations, the most common combinations of cranial nerves involved in the multiple cranial nerve palsies are the third and fourth cranial nerve, fifth and sixth cranial nerve, fifth and seventh cranial nerve. These are all the most common combinations of the cranial nerves involved in multiple cranial nerve palsies. Now, what are the different syndrome causes causing recurrent multiple cranial nerve palsies? The causes are the first one is idiopathic. The cause is unknown. The other most important cause is the diabetes. So the diabetes causes recurrent cranial nerve palsies. There are two other idiopathic conditions where there is multiple cranial nerve palsies. They are the idiopathic cranial nerve polyneuropathy, that is ICP, and the other one is idiopathic hypertrophic cranial pachymeningitis. So these are all these are the two idiopathic conditions where we see the multiple cranial nerve palsy. Now let us see the most common sites causing the multiple cranial nerve palsies. The most common sites are the first one is cavernous sinus, then brainstem, and followed by the individual nerve trunks. These are the most common sites involved in the multiple cranial nerve palsies. Common neoplasms involving the meninges are the small cell carcinoma of lung, melanoma, myelodysplastic syndromes. These are the most common tumors involving the meninges. When there is neoplastic meningitis, there is a triad called the first one is evidence of the meningeal signs, the other is headache, and the third one is raised intracranial pressure. So these are the three signs where we see in the neoplastic meningitis. When there is 6th and 12th cranial nerve palsies, it is suggestive of involvement of the clivus, that is neoplastic spread to the clivus.